When a child under 5 gets malaria, it can be a life or death situation. They need to get treatment and to get it fast, as it can easily become an emergency.
Okay, this child came. There was history of convulsion at home and in triage. The child came here. I do my HOD assessment. The airway was patent. There was mild respiratory distress. And the child, whilst I was doing my HOD assessment, when I reached to see, the child started convulsing.
Malaria is endemic in Sierra Leone, which means that in all the districts, the incidence is high. But then you have certain districts based on the malaria indicator survey, which was done in 2016, where the incidence varies. Malaria accounts for between 37 and 40% of all the outpatient visits that occur in Sierra Leone. And then for the deaths, it's between 11 and 15%. But then, of course, we know malaria affects us all, but then, of course, there are vulnerable groups like the under 5s, the pregnant women, and lactating mothers.
WHO estimates that malaria accounts for 20% of deaths for children under 5 years in Sierra Leone. This calls for effective malaria prevention and control efforts that are currently guided by the National Malaria Control Program.
Okay, so the interventions, of course, we know the evidence-based interventions are you use your long-lasting insecticide-treated nets, which you are supposed to use correctly, consistently. That means you should sleep inside your nets every night. And then, of course, we have case management. That means if you are sick, you go to the facilities, you are tested, and then if you have malaria, you are treated. And then, of course, we used to do IRS. It was a pilot study in 2011, but it was just in few districts. But then, of course, we know IRS costs quite a lot. And then with our association, we need other partners to come on board. And then a year and a half ago, we started implementing IPTI, which is intermittent preventive treatment in infants. And this we do for infants which are between 2 and 9 months. And this is done in line with the EPI schedule when they come for their vaccines at 10 weeks, 14 weeks, and at 9 months.
There are challenges, however. For example, the reliance on traditional medicine, when patients delay getting to hospital, when patients do not follow instructions as directed by their health providers, or when the hospital runs out of supplies.
Well, sometimes this one was delayed because the child has been sick for the past 3 days, according to the mother. They only came with the child because the child started convulsing at home. That's why they brought the child. Sometimes we come with them here gasping, yearning for life. So we have to resuscitate them, we gain them. Some of them we resuscitate and get their life. Some of them they die.
Malaria of late, more especially among pregnant women, is becoming alarming. Maybe the reason or the reasons could be we are supposed to be treating them intermittently for malaria to prevent it. But there are times we have shortage in the supply chain. So anytime we have a break in the supply chain, there is a hike in malaria cases, especially among pregnant women.
Despite the challenges, there is good news. Through funding from UK Aid, WHO initiated the Intermittent Preventive Treatment in Infants IPTI program. It initially started as a pilot in 2017 in 4 districts: Cambia, Pujehun, Kenema, and Western Area Rural Districts.
One of our partners, ICAP, has conducted an assessment in relation to the first district where the pilot was started, that is in Cambia district, and that assessment was to inform the rollout into the other districts. And it was found out from that all the mothers were willing to accept the IPTI, and then in the last year, the health workers as well have found out that there has been a decrease in the number of malaria cases based on their data in each of the most of the facilities. There has been a decrease in the number of malaria cases that report to the health facilities, and the severity of the malaria cases has decreased.
I am very, very pleased with the IPTI because I make sure the chain doesn't break for the infants, because I want to monitor them. I want to know how successful these people say we should do this. How is it helping the children? So I always make sure, instead of the chain break in the infants, I make sure it doesn't.
Other partners involved in the implementation of the National Malaria Control Program include the Global Fund and UNICEF, who believe that the reduction of malaria mortality rates in Sierra Leone will depend largely on the implementation of this program.
So far so good. That's what we've done for this child. Within 30 minutes we've completed our mission. So this is how Intact works, and this is how Intact, that is how they were trained. We were trained and now we are doing it, so we thank God for that.